Hey everybody, I wanted to walk you guys through our chest and abdominal viscera chart today in regards to the cardiovascular system, specifically the heart. Right here in between the two lungs, I can see the outside of the pericardial sac, so that's going to be fibrous pericardium. And if I could peel that off underneath of it, I would find the parietal pericardium. I can also see a variety of vessels up here, but we'll save vessels for another video. In this image here, we've opened up the pericardial sac, and we can actually see the cut edge of it along here. And we've removed both the fibrous pericardium and the parietal pericardium, which would be under it. I can see the pericardial cavity, which would be filled with serous fluid, and then the visceral pericardium would be attached to the outside of that heart. Recall that in the chest, that heart doesn't sit exactly right-left, but the anterior part of the heart that we see here is actually the right side of the heart. So this is my right atrium. This would be my right ventricle. I can tell right away that this is the right atrium because I see that superior vena cava coming into it. This is my right ventricle with my pulmonary trunk, and I can see a pulmonary artery heading over there towards the lung. I can see a little bit of my left ventricle here, and I can see the aorta, which would be going behind the pulmonary trunk and coming out of that left ventricle. I can also see some grooves on the outside of the heart. The groove that this vessel is sitting in here is an atrioventricular sulcus, and the groove that these vessels are sitting in is an interventricular sulcus between the ventricles. Speaking of those arteries, since we can see them, this would be my right coronary artery, giving off the marginal artery. And over here I have the anterior interventricular artery between the two ventricles. The circumflex artery would be following around to the back of the heart from there. Any of the veins on the outside of the heart we're going to call cardiac veins, and they'll all go into the coronary sinus on the back of the heart. All right, moving down here, we've got a view of the heart that's been opened up. Again, I've got my right atrium, my right ventricle, my left ventricle, and then my left atrium would be on the posterior side of the heart. I see the superior vena cava going into that right atrium. I see the inferior vena cava also going into that right atrium, and attached to that right atrium I see the right auricle. My other big vessels coming out of my left ventricle is my aorta. I see the aortic semilunar valve at the bottom. And then coming here out of my right ventricle, I see my pulmonary trunk with the pulmonary semilunar valve at the bottom. And I see that pulmonary trunk splitting pretty quickly into the two pulmonary arteries. In blue here because they contain oxygen-poor blood. I also see my atrioventricular valves, my right atrioventricular valve, aka tricuspid, and my left atrioventricular valve, aka bicuspid or mitral valve. I see some papillary muscles attached to some chordae, tendonae, and then attached to the valve structure itself. So those papillary muscles are going to contract when the ventricles contract to keep that AV valve shut so that blood doesn't flow backwards up into our atria. I see the apex of my heart here, and I see the interventricular septum there.